Dr. Anshu Chaturvedi is a highly experienced renal clinical dietitian with a PhD in renal nutrition, over 12 years of expertise in clinical nutrition, specializing in the management of various lifestyle disorders, including diabetes, chronic kidney disease, and other related conditions. She focuses on the development of personalized nutrition interventions that enhance the health outcomes of patients. Welcome, Dr. Chaturvedi. Such a pleasure having you on. So, I want to first dive in to really understand a little bit more about this relationship, or and your interest in this relationship between clinical and looking clinical nutrition specifically, and then chronic illness itself. What drew you to that? How did you end up in this space?
Yeah, so first of all, I would like to thank you for inviting me to join today's podcast. And it's a real privilege to be here, especially to discuss such an important topic that is diabetes and its impact on nutrition. So, my journey as a clinical nutrition is deeply rooted in empathy and a desire to help those experiencing significant health challenges. So basically, I still remember that during my internship days, when I used to go to the ICUs and I used to visit the dialysis unit. So patients who were admitted there, they suffer more than as compared to other patients. So that led me to explore of fundamental aspects of lifestyle management and to understand how nutrition, exercise, lifestyle, daily habits can play a transformative role in prevention and the management of chronic illnesses.
Thank you for the context there. I mentioned earlier that in your bio that you've worked within chronic kidney disease, within diabetes. So you're really working with a variety of health conditions related and sometimes not as closely related. You're also doing some work from like thyroid disorders, which is very interesting, to diabetes, again, to gut health. How do you curate a personalized diet plan, like across all of these different things, for patients with these various needs?
Yes. So I want to mention here that almost 4 years back I diagnosed with IBS. So that time I was more curious about to know more about the foods because doctor had placed me on the medications and I was not willing to start any kind of medications. So later on I came to know that IBS I had developed just because of my high stress level, and I was not taking care about myself. So I suddenly became lactose intolerant, glucose intolerant, and I developed lots of sensitivities also, that is caffeine and alcohol and so many sensitivities. So that time, I promised to myself that I will cure each and everything from the diet only and from the change in my lifestyle only. So during that research period, I realized that the best way to plan a diet for everyone is the intermittent fasting. So this can be tailored based upon your body size as well as depends on your composition goals also. But it is important to remember that the body shape alone doesn't dictate your metabolic health. Still, intermittent fasting protocols can adapt it for everyone, because it depends on your visceral fat, your subcutaneous fat, as well as muscle dominant personality or lean type of personality. So basically, we can divide intermittent fasting or type of bodies into four categories. So first category is pear shape, where lower body fat get uh, deposited, and it is very common in women where fat get stored in their hips and their buttocks and their thighs. So the goal should be to improve insulin sensitivity and to maintain their lean body mass. So for this, I recommend them to maintain at least 10 hours of eating window, and that help them very greatly to achieve their results. Second is apple shaped body. We can name it as central obesity also. It is prominently we can find in males rather than females, where fat get deposited around the abdominal cavity. So, this type of obesity indicates higher risk for diabetes, cardiovascular disease, and other type of metabolic syndromes. So, the goal is to reduce their insulin sensitivity, their visceral fat, and so I suggest them to maintain just 6 to 8 hours of eating window for such people. OM80 diet, you must have heard about one meal a day. We also suggest such type of diet for the patient, but this type should be taken in a strict supervision of a dietitian. Third type of body type is muscular type, which we see in mostly athletes. So its goal should be to enhance performance and maintain lean mass. So they should follow eating window of 10 hours. Fourth type of personality is lean type of personality, where people are not tend to gain weight very easily. So 12 hours eating window is suggested for them. And also they should focus on a good nutrient based diet just to avoid the risk of malnutrition. So this is my basic principle of intermittent fasting. On that basis, I make tailor-made plans for my patients.
So that's interesting. And I should also note here a lot of the work that you're mentioning here, Dr. Chaturvedi. Can you tell us a little bit about where you're doing it, and what are the types of things that you're seeing from patients as well?
You are asking about their experiences.
Yeah, exactly. So their experience, and then it may also be notable to mention which part of the world that you're sort of working to implement all of these different things.
So basically, if we talk about their experience, so they find some problems in achieving the 10 hours eating window or 8 hour or 6 hours eating window. So gradually we increase their time period. Initially, I give them 14 hours window. For the next week, I give them 12 hours eating window. And then for next week, I give them 10 hours eating window. So gradually they adopt these habits of eating, and then they become comfortable with that. So if whenever they reach 12-hour eating window or 10 hours eating window, their HbA1c also seems to come down. I have seen in many patients that intermittent fasting help them a lot by taking down their levels of HbA1c.
And then for location, you're doing a lot of this work in Jaipur. Is that correct, in India? Okay, okay. So just for context as well for our American audience as well. I wanna then next go to our next question, which is, what is your approach for someone looking to improve or change their diet while managing multiple health conditions? So you talked about intermittent fasting across different health conditions as well. But when we're looking at multiple health conditions, are there other precautions, other things that you take into account as you're considering their diet plan?
Oh, it's a great question. So, when someone is looking to improve their diet along with intermittent fasting, so in that case, their metabolism improves, and if they eat in a proper sequence. So, eating sequence matters a lot, and this can significantly affect their metabolism, their blood sugar regulation, their insulin response, their satiety, especially in diabetic patients or other metabolic health management. So now, what is the basic principle of eating? So, they should eat fiber first, means salads, fruits, foods which are low in glycemic index, as well as saute vegetables. So these should be taken at the very first when they start your meal. Second, uh, you should eat proteins and fats that are beans, butter, pulses, legumes. So these things should be eaten at the second place, because these reduces the rate of glucose absorption. Third is to enhance the glycemic control and satiety. You should eat your carbohydrate at the last. Carbs means it can be a bread, it can rice, it can pasta, or anything else you are eating. So, fiber, protein, fat, and carbohydrate. This should be the sequence of your eating. So, in so many researches, it has significantly decreased the postprandial sugar by 20 to 40% in the patients who suffer with type 2 diabetes.
So, what you're saying, Dr. Chaturvedi, is not only important to understand what you're eating or how long your eating window is, but even the sequence of how you go about eating is just as important. And I'm curious about if you can elaborate a little bit more about the sequence of being able to eat and this impact on A1C. So with carbs, or with carbs, you mentioned eating it last, but I assume then you're saying don't start out with the carb because then that will spike your blood sugar. You don't have the fiber, you don't have the protein already in your system to help slow that down. Can you walk us through? Can you expand on that a little
Yeah.
bit?
One point I missed on that if you are taking beverages along your meals, so it should come at very first. Like if you are taking any kind of buttermilk or soup or anything, or if you will take liquids at first, that would be the best thing you will do with your meal. And now I'm coming to your point that why fiber and why fiber we are taking at first, because fiber gets digested very easily. It doesn't take much time to get digested. If you will eat fiber at the last, okay, pardon. So if you will eat carbs first, then you will eat protein, and then you will eat fiber. So fiber will stuck at the top of your gut. So it will get fermented and it will cause you gas. Also, it will not help you to regulate your insulin, and it will not reduce the rate of glucose absorption. So when you eat fiber first, it gets digested very easily, and then it gives a base to get digested protein and fat easily. So at the second, when we eat proteins at the second, protein takes longer time to get digested as compared to carbohydrates and fibers. So protein will release energy very slowly and gradually, and by that time your insulin level gets settled, and then insulin will will digest the carbohydrate part, by because the time your insulin will reach here, by that time your carbs will get digested by half from your gut. So by this mechanism, your glucose absorption will increase in the body and insulin sensitive will become more better. I hope I am clear on that.
No, that's helpful. So it's the sequence of being able to start with your fiber, then going to your protein. You first start out with the food, if I understand correctly. You start out with the food that is easily digestible. You're laying a base down. You put protein on top of it. It takes a little bit slower, and then finally you finish up with the carbs. And you said to start out with the beverage and get the beverage done. And assuming when you're just as a clarifying point, when you're saying start out with the beverage, you don't mean a high sugar
Yes,
beverage you're
yes,
talking about.
yes,
Okay.
yes.
Okay. Helpful. How do you, I'm going to move on to the next question. What role does poor metabolic health play in the development of diabetes?
Okay. So, poor metabolism is like metabolism. If we talk about inflammation also, so if we talk about any kind of chronic diseases, that starts with the inflammation only, and poor metabolism health is the foundation for the development of type 2 diabetes, because it creates a physiological environment where the body gradually loses its capability to manage glucose effectively. So, metabolic health refers not only for blood glucose regulation, but it also refers to maintain the blood pressure. It also refers to maintain your lipid levels. And as we know that the diabetes is directly connected with our liver. So it is essential for our liver health also. So, and if one person who has a poor metabolic health, so they may have high blood pressure along with higher blood sugar levels. They may have obesity also, and they may have deranged lipid parameters also. So, when someone has poor metabolic rate, their cells become less responsive to the insulin. Then, to compensate, pancreas has to produce and more insulin, and then pancreas gets exhausted, it gets burns out, and then insulin production declines. So when the insulin level declines in the body is not able to metabolize glucose very properly. It's not about just glucose, but other type of carbohydrates also, and that results in the elevated blood sugar levels that further leads to pre-diabetes, and if it is ignored, it can lead to type 2 diabetes also.
I'm going to move on to the next question, which is around something that even we get questioned on often, which is around understanding what foods should I eat, what foods should I avoid. Like people like separating and like this is a bucket of good foods, this is a bucket of bad foods. So, anyways, would like to get your recommendation on it for our listeners here today. Are there any specific foods, ingredients that folks cook with that you often recommend to support or improve blood sugar control?
Good food and bad food. There. I cannot categorize them into a good food or a bad food. Like every food is good until unless your body is accepting that food. And if we particularly talk about diabetic patients, the food should not be high in glycemic index as well as in glycemic load. Another thing, if a diabetic patient is maintaining a good level of HbA1c that is around 6.5, or they are maintaining a good level of postprandial blood sugar and pre fasting or preprandial blood sugar, they can have each and every type of fruit. They can have each and every type of fruit. All they just need to avoid fruit juices or extracts of anything. Another thing, uh, along with eating, your physical activity matters a lot. Like how much you are doing physical activity. I have seen many people, I have many patients, they used to come to me and they said ki we are following the diet chart you have given to us, but still we are not achieving our targeted blood glucose. But when I asked them about their physical activity, they say no, we are not able to continue our walking or gymming or yoga, whatever you have suggested to us. So if you want to eat everything, you will have to go for any kind of physical activity also. So there is no good or bad food. Another thing which I would like to mention here, there are some foods which gives your body more inflammation. So uh, these are non-vegetarian foods, like it can be chicken, it can be mutton, it can be beef, and even can be the milk. So these are the food which are rich in protein. These all comes from animal part. So although they are good in high biological value protein, but they are proven as a more inflammatory agent who creates more inflammation in our body. So I would suggest to not to consume them on a regular basis or try to avoid them, because we have so many sources from our vegetarian side. We have so many sources of plant-based protein. Plant-based protein are proven to not to produce any kind of inflammation in the body. So better to switch to a vegetarian diet.
That's interesting. And in what you're saying is that, one, take the sugar content and be sort of mindful of that. But then also at the end there, you mentioned about animal protein versus plant-based protein, the animal protein being the source of causing inflammation itself. I'll move on to the next question, which is, what are some simple or easy dietary habits? Because not everyone can give up animal protein, or sometimes it's just not part of their lifestyle, right? But anyways, what are some simple and easy dietary habits that most people can adopt in their everyday lives that will support their long-term health?
Okay. So basically, the people who want to achieve a good lifestyle or good eating habits. So first of all, they should work on their eating habits first. Intermittent fasting, which I have already explained. Second, their meal timings and their portion control. So the meal timing. First, I'm coming on meal timings. So they should eat their meals on consistent timings. If they are not able to remember, they can set alarms, they can set reminders for themselves. Initially, the aim should be three major meals along with two to three small meals in a day. And these small meals cannot exceed more than 20 calories, because whenever we have anything which is more than 20 calories, it gives a glucose spike in our body. Also, the last meal of the day, that is dinner, it must be finished before at least 4 hours of your bedtime, so that if your body clock will be aligned with the circadian clock, your internal body organs, the most important organ is liver, will start working for detoxification at that time. Okay, so when we sleep around 10 or 11 p.m., then around 12:30 or 1 o'clock, that is the time when our liver start detoxification in the body. So dinner should be eaten before 4 hours of the bedtime. And third, I'm coming on the portion control. So I teach them hand method, like vegetables and fiber, both hands cupped like this. This much should be the amount of vegetables and fruits or non-starchy fibers. Second eating sequences for the protein. So protein should be one palm size. It should be like it can be beans, it can be lentils or green leafy vegetables also have a good amount of protein. So I am keeping this in the category of protein only. A good green juice can also help you to maintain uh, balance of calcium and protein as well as chlorophyll in your body. So if you are having a green juice, drink it at the very first. Second, you have fibers, and third, have your proteins. And for the hand method, carbohydrate, which we say pasta or rice, it should be just one fist. And for the fat, it should be tip of your thumb. So these are the these are the portion method which I used to teach my patients. I would like to mention one more thing, that another way to guide them, or anyone Mediterranean diet, if I talk about, so anyone can follow that. Like if we take a 9 inches plate and we divide that in three portions, so first half portion should be full of non-starchy vegetables. Half portion, one-fourth portion should be filled with protein, and rest one-fourth part should be filled with carbohydrates. So, along with 1 teaspoon of healthy fat, it can be any butter or non-refined oil. Along with that, we can add a bowl of yogurt. So, same plate can be eaten in the morning, lunch, or at the time of dinner also. So, it's not mandatory to have three meals. You can have two meals also in a day, but try to have 3 to 4 in between meals. And again, I'm repeating, it should not contain more than 20 calories.
So that's a helpful rule of thumb that you walked us through. In the U.S., we call it the My Plate.
Yeah,
Is how the
yeah.
USDA has mentioned that. It's super helpful. Oh, go ahead.
No, you can continue asking another question if you
Okay,
have.
okay. I thought you were adding something.
No, no.
Okay, well, super helpful, Dr. Chaturvedi. At this point, we are toward the end of the interview. I would love for our listeners just to know how they can connect with you, just learn more about your work. You're all the way in India, but if we want to follow your work and what you're doing over there, how can we connect with
You
you?
won't believe, like so many Indians who are living in America, and especially Jaipurites who are living in America or London or any other countries. Whenever they come to me, they take my number and they ask, "Ki, ma'am, this I we will continue your diet even after going there. Just tell us the options which are available there and what can we choose out of them." So it gives me immense pleasure that they used to follow my diet only. So my patients or clients, you can connect me on my email ID, that is ANSHUCHATURVEDI, that is Anshu Chaturvedi 091 @gmail.com. You can find me on Instagram also with the name of Anshu_Chaturvedi.
Perfect. And we link up your Instagram and everything in the show notes so folks can have quick access to your Instagram page as well. With that, Dr. Chaturvedi, thank you so very much for your time. To our listeners, thank you for your time and for tuning into another episode of the Yumlish podcast itself. You know what time it is. This is where we head over to social media and answer the following question, which is, have you made any changes to your diet recently? What do those changes look like? Perhaps you're intermittent fasting. Perhaps you stopped intermittent fasting.
Yes.
Whatever your journey looks like, tell us more about
Yes,
it.
so
Again, head over to @Yumlish on Instagram and Facebook. Find this podcast post and comment below to tell us how have you made any recent dietary changes and what that looks like. Dr. Chaturvedi, I think you were adding something.
if I talk about my schedule, I don't eat anything and I don't drink anything in the morning before 9:30. So my first meal starts at 9:30 and it's a green juice. It's made up with the spinach, green apple and whatever is available in the season. And then I take my nuts, that is almonds and walnuts. So just two walnuts and two whole, two whole walnuts, that is four, and two almonds. Along with that, I take black raisins because my blood group is O negative and I have to maintain my hemoglobin level. So I take black raisins for that and I take two figs also along with that. Then I eat my fruits. So this is the sequence of eating. Then I eat my fruits and then I eat my cereal. It can be, in India, we have poha, upma, some South Indian foods like idli. Sometimes I have rolled oats and quinoa also. So this is my breakfast. After coming from my hospital, my patients round, my IPD rounds, I again have one fruit around 11:30 or 12. Then I have my lunch around 2 o'clock. Like it's like more of pulses, less of carbohydrates. So um, you must have heard about now how to explain that. Like we have oats, roasted oats powder, along with roasted chana powder, that is the yellow dal, yellow lentil, and we mix them along with a little bit of curd. And this is my protein for the lunch with, and then I eat just either one chapati or little bit of rice, just because I am in the sedentary lifestyle. I don't want to eat more. Even if I am willing to eat more, I'll have to stop eating when I feel like 80% full. Yeah. And then
Very
yeah,
helpful.
and then around 4:30 I just have 1 to 2 teaspoons of seeds. It can be, sometimes it can be pumpkin, sometimes it can be flax seeds. And then I finish my dinner before 7 o'clock. It is more similar with my lunch only. And after that, around 10 o'clock, I have a chamomile tea, nothing else. So basically, I am a vegan. Just little bit yogurt I add in my diet, and I can fulfill my requirements with the plant-based diet.
Lovely. Well, as a bonus, our listeners got to also learn about your diet. So thank you so much for sharing that as well, Dr. Chaturvedi. We will wrap up the episode. Thank you again for your time. And to our listeners, we will see you on the next episode of the Yumlish podcast. Again, head over to our social media and answer the question I asked previously. We will continue the conversation there until next
Yeah,
time.
yeah.
Bye bye.
Bye. Take care.